I'm Antonio. I'm a patient at CPMC, and I had a heart transplant. My first doctor treated me my problem as asthma until I was 5 years old. Then I changed the house, and a new doctor recognized my heart problem. And at the time they were calling, even today, rheumatic fever, when I had another major failure, and this time was a tachycardia, very severe, and consequently I needed a heart transplant. When they talk about heart transplant, I was in shock, and I was really concerned about if I was make it a heart transplant. My major concern was after the transplant, I'm gonna be able to work again. I'm gonna be able to be like before, and to lift weight or to run around, or my mind is gonna be clear. After my first transplant, I felt really, really good, like a new person. Rather than new person, a new body. I was able to do everything I was doing before my heart failure. My first transplant lasted only 4 years, and the reason is they went into rejection.
But Antonio, other than the heart transplant that was failing, was otherwise in excellent shape. So we felt that he was a great candidate to have a second heart transplant.
This time, it was very, very easy for me to process the new surgery because I went through the first one, and I was very confident on the team.
We listed Antonio, and he actually waited at home. So he was well enough to wait at home, and we called him in when we found that perfect match for him.
They called me in the middle of the night, and they say, tomorrow morning you'll come over, have your transplant. And so I was very confident and happy to hear that after only 3 weeks. And I went to the hospital, and I have a picture of me handing the hospital pajama pants and with a big smile, and ask the nurses, do whatever you want with me, I'm ready.
We have achieved these successes on the backs of our forefathers, and just a mountain of learning and research and development.
CPMC has a rich history in the development of heart transplantation and surgical techniques that are used worldwide.
It's just thrilling to be able to put people back in a place where they're happy when they were essentially bedbound and facing imminent death. It's a highly dramatic event that we're just fortunate to be a part of.
And after the surgery, you are able to do everything you did before, maybe better, because your mind is much clearer.
Is the case nowadays with heart transplantation. He went home within 2 weeks and has done extremely well.
I'm very healthy, I feel very good. I took cardio rehab classes, and I'm very strong on that. I do exercise 3 times a week under supervision of nurses. I feel great. For people that are waiting on the heart transplant list, I know for fact I've been there 2 times. Very hard. In your mind, everything goes through, but if I can say at the CPMC, the team is superb. You are in good hands.
What always amazes people is how well people do with it. And other than taking a few more medications, you live a perfectly normal quality of life, uninterrupted, which is our goal, and we call that a hit.
I went to see my family back in Italy because they needed to see me alive and in a good shape. So I went there for a couple of weeks, and I was able to do the trip without any trouble. Yes, I've been through a lot, but life is too short, as they say. So take day by day, and carpe diem, take the moment.